Hi.
This is hard. This is hard now. The pressure's on.
Starting the conversation is always the most difficult part.
I know.
So, how was your day?
It's a good day. It's a busy day. I really appreciate the opportunity here to exchange ideas, to see colleagues all in one place instead of having to travel a lot to different places, and to have good discussions, even disagreements and arguments about science and about dentistry. So it's a lot of fun for me personally.
Perfect. So, Professor Mark Latta, I think you are well known all over the world, but if you would like to introduce yourself,
Sure.
how would you introduce yourself?
I started off life as a chemist professionally, and then went to dental school, did graduate training in hospital dentistry, and then I practiced for 5 years. Then I got another graduate degree in oral biology with a focus in biomaterials at the University of Maryland. I got my dental degree from the University of Pennsylvania. And I had experience working in the dental industry. After practice, I left practice, full-time practice, and worked in research and development for a dental company. And so I got a very good appreciation from behind the scenes of the opportunities and challenges that the profession has in advancing new techniques, materials, and therapies. I did that for 7 years, and during that time I was working with different universities and had the opportunity to leave the industrial work and go to work at a university. And I have been at the university now almost 30 years, doing research. Yeah, I'm old, yeah. Doing research the first 16 years. And then I served as the dean of the school for 10 years. And I stepped down from that position in 2021. And the last few years, I've been back on the faculty, teaching and doing research. So I have a very diverse career with a strong appreciation for the complexity of bringing new products and new ideas into clinical care.
Nice. And just I would like to ask about your thoughts on, meetings like this and the importance of having, these conversations, and that, we need innovation in dentistry in order to bring products to the clinic. So what's your outtake on that?
I think this meeting is very important. Fundamental research is needed before translational and clinical advances can be made. And this meeting is a wonderful mixture of basic science research, translational evaluation of some of these technologies, and then actual clinical applications. Because not everything that, from a basic science perspective, that is developed can be translated easily and practically into the hands of a dentist. And so the mixture of scientists, both PhD scientists, laboratory scientists, translational scientists, which usually are scientists with scientific training but are clinicians, and then clinical scientists, is an important mixture because not every good idea, even from a development lab, can be easily used by the dentist to help their patients.
Yeah.
And so having all of these perspectives in one location, I think really helps move the development of materials and techniques so that we can provide better care for our patients. Because at the end, I recognize it's a business that the companies have, but the business is served by advancing good care.
Yeah.
And I appreciate how important it is what companies do in supporting academic work. And because I think a company like GC and other high quality companies understand that in the marketplace, that being evidence-based means greater chance for success.
Yes. And plus, at this time, not only the dentists, but also the patients are becoming well informed. So,
well, that is true. But my experience, both as a clinician with patients and also with our students, is there's the social outlets, the social media platforms that are out there, YouTube and Instagram, dental influencers, if you would.
Yeah.
Not always will the information that's being absorbed by clinicians and our students, and I know this from our students, is evidence-based. And so I think it's very important that there would be a strong, objective, evidence-based community that either supports what's out there social media,
Yeah.
because it's not reviewed, it's not refereed, it's just out there.
Yes.
And I think it's very important that there be a mixture. On the other hand, sometimes we in the academic world can be maybe too slow to adapt and change from traditional paradigms. And so the push-pull from younger dentists and the social media outlets proposing, challenging us actually, is not bad, but it has to be taken. Dentists are very busy. It's difficult for them to understand and really vet true high quality science and fact from fiction.
And what do you think is the role that dental researchers have to do in informing practitioners?
Yeah.
Probably that
Yeah.
like you said, like probably consume their information through social media.
Yeah. Well, I think evidence-based researchers shouldn't be afraid. So some people of my generation, I have been now a dentist 41 years. I like to say I understand and practice digital workflow in terms of therapies, in terms of social media and communication. I'm a bit of a dinosaur. Okay. Yeah. So I don't appreciate as much as of our students about those channels of information. Mm. So I think we as scholars and researchers who do this as a profession, as a service to the profession, but also this is our jobs, should try to embrace these alternative ways, maybe a little different than the traditional peer-reviewed manuscripts, because that takes so much time. Now, one thing this meeting does is it provides an outlet for late-breaking innovations. And I think this is where social media and some of these channels can be really valuable in pushing the profession into areas that more traditionalists may not want to. So I think we have a role. I think we have to be mindful, though, of the first point that I made. Translational scientists and clinical scientists understand that there are things we can prove statistically in a laboratory that in a real clinical situation don't make a world of difference. And,
that is an argument that I hear a lot also.
Yeah. And so, one good example, we all know as the population ages, as people keep their teeth longer, there are more challenges for preserving the dentition. And we hear a lot about bioactivity.
Yeah.
No one has definitively, the FDI has made a position paper on its definition, but it's so broad. And for commercial reasons, that narrative, that nomenclature has been marketed a lot.
Yes.
But there's no solid definition of it. And there are many products that have, for example, inorganic ion release, calcium and fluoride, for example, that in an in situ or laboratory situation show positive effect for remineralization, to use that as an example.
Yeah.
But that in most patients' mouths won't matter because the patient host effects are overwhelming any minor ability for what we can show in the laboratory to have a real clinical effect. And it's very expensive to do randomized controlled clinical trials to prove things to the level that we see in medicine, particularly in drug delivery. And so there's a lot of implying that certain things happen. It makes sense. Everybody knows fluoride's good, but nobody knows how much fluoride is needed, for example. Exactly. And so I think it's important that we educate our dentists as to being cautious consumers of marketing claims as new technologies come out. I'm old enough, so for example, I was actually working in the dental industry when digital scanning and CNC machining of restorations was starting. I'm that old. So, the parents of this revolution, Merman and Brandestini at Zurich, François Duret in France, were pioneers in this area. But it's only been the last probably 10 years, really, that the digital workflow has been firmly established, evidence-based, proof, materials are available, technologies are available, and cost reduced to make it economically sensible for many dentists to use. So dentistry evolves very slowly, but it was driven by Brandestini and Merman and François Duret. And we needed these risk takers to drive what is now, certainly in the dental laboratory and in many dental offices, pretty standard as far as digital workflow.
But like also like as you mentioned, like there needs to be some balance between being risk takers and making sure that these risks are also evidence based or
Yes.
right?
Yes, and that goes back to how do commercial entities validate to the level of risk management from a patient safety perspective, but also ethically from a perspective that the dentist can be assured of a quality approach, product, material for addressing the patient needs. And it's expensive. It's an expensive and time-consuming proposition. And it's a very competitive and crowded marketplace. So I have great respect for the work that companies do, because I think many clinicians really underappreciate the challenges. For example, just from a regulatory perspective, the new MDR regulations in Europe, the Food and Drug Administration here in the United States, create big challenges for commercial companies to get genuinely new and innovative and patient beneficial techniques and materials, but there's a lot of hurdles to go over.
Yeah. Well, thank you very much for your insight, Professor. I appreciate your time. I know you're busy, so I'm not going to take so much more from your time.
It's my pleasure. Thank you for asking.
Thank you for passing by.
Okay, good day to you.
Appreciate it.